You're in Cleveland, Ohio, on the grounds of the Rainbow Babies and Children's Hospital, one of the most amazing institutions in the world for the care of children who are in desperate need for help. It's not only a hospital, it's also a research facility, a world leader in finding innovative approaches to beat childhood diseases. And this is Dr. John Letterio, Chief of Pediatric Hematology and Oncology.
The journey begins here. It's a wonderful place to work in an amazing safety net for children in our community. I don't think many families anticipate needing the services that you find in a hospital like Rainbow, but knowing that it's here and that you have access to some of the brightest and most talented specialists right in your community when you need the most is such a comfort. When you walk through the front doors of a children's hospital, one of the things that we really want to emphasize more than anything is comfort. Lots of color. You can go to many hospitals where there's a tremendous amount of really stark features, lots of white. So much color in this facility. A lot of emphasis on the whimsical features of the environment that surround the kids while they're here. So when you come off of the elevator, you see this beautiful greening wall with lots of light. And as you walk through the facility, if you're a child with a young patient, you go one direction, and it looks just like a children's hospital with little furniture and primary colors and play areas. But if you're a teen and a young adult, if you're in your late teens or early 20s, and you're here studying for college, and you're looking to be surrounded by patients your age, you come to a different area. Oh, this is a great thing. You guys are all with Flashes of Hope?
Yes.
I'm Dr.
Hi,
Letterio.
Hi. Nice to see you, Loretta.
Sam.
Sam, very nice to meet you.
Hi, I'm Karen.
Karen.
Flashes of Hope is a nonprofit that was founded by Allison Clark, and we provide family portraits to families coming to the hospital for outpatient care, chemotherapy, life-threatening illnesses, sickle cell, and it's a gift. And they get hair, makeup, and just feel beautiful again. Make them smile.
We were just diagnosed at the end of June, and so we're pretty new in all of this.
Yeah.
And
Right, and you go from having a family with no real health issues, and then
everything.
you throw something like this in there, and it changes your whole.
it changes everything.
Yeah.
So, you are your kid's proponent, and you're with them every day, and you know them because they're your kid.
Yeah.
And if you're saying something isn't right, they listen.
To me, that in the midst of the most complicated medical crises, you can see kids in this hospital with smiles on their face. They're enjoying things that they're surrounded by, and there are staff here, music therapists, art therapists, many other people that are supported by the hospital as part of our service to make sure that kids are getting everything they need to enrich their life while we're taking care of their medical issues. Our message to the families is that let us worry about the medical care. We'll take care of the problems that you're facing. Can I play? Darian? Okay. What color are you, red or yellow? Red. Okay, I'll be yellow. I'm okay with that. Young kids might not know how to say, I love you, or to provide some sort of positive feedback to a caregiver, but you put a pen in their hand in a place where they can draw, and it's amazing sometimes the things that come out. And if you walk through this space at the end of a very busy clinic day and you walk through these rooms, many times you'll find a very heartfelt and very emotional note that's, someone's put on the wall. And, I have a collection, pictures of these notes that I've kept. And for me, it tells you why doing something like this matters so much to the patient who comes here. It's really quite special. How do you make the lives of people around you better? As a physician and as a scientist, my whole career has been oriented around, how do I come up with something that's safer, more effective, less toxic, and ultimately will change outcomes for families. And that's always been a driver for me. I think my desire to be in the lab is that when you go through an experience where you're prescribing these medications and you watch what a patient goes through and you see their experience dealing with side effects and toxicities, you're compelled to say, we've got to do something better. And for me, the easiest way to help myself deal with that emotion is to say, I'm going into the lab. It's a terrific facility. One of the greatest things about our space is that we're immediately adjacent to the medical school campus. So you can go from an environment where you're involved in caring for patients and then walk over to a research facility. You can, in essence, walk from one laboratory to another. It's lunchtime, so it's pretty quiet here, except for one of the most hardworking people I know. How are you doing?
Good, how are you?
Yeah, so Emily is one of our former graduate students, now postdoc, who got her PhD in chemistry.
Yeah, we've been studying these triterpenoids as potential chemopreventives. So something that somebody who has a higher risk for cancer could take in order to prevent the cancer from developing.
So can we develop something that, that there's a much more rational basis for using, not just to suppress the inflammatory process, but potentially reduce the risk for cancer? So you're standing in Angie's garden. You know, it was really inspired by Fowler.
I'm Charlotte Fowler. We had 3 daughters, and unfortunately, we lost our youngest, Angie, at age 14 to melanoma. We found ourselves in a situation about 6-7 years ago where we thought, you know, we think we could make a difference some way for Angie. It's just very frustrating and challenging as a parent to feel kind of helpless, you know, when your child is undergoing things and you can't make it better.
It was really the vision of Chuck and Char, Angie's parents, to create a space like this that could allow families to come outside into fresh air, to see things that are part of nature without having to really leave the hospital. There are 2 children in the family who were actually battling cancer at the same time, and they were both in the hospital, and it was around the 4th of July. And the garden wasn't quite open, but we just did a special evening for the 2 of them, so you could come up here, and on that evening, you could see fireworks in every one of the municipalities around Cleveland. It was completely magical, and it was a chance for kids to actually enjoy being in the space. And I've said that one night for that family made every bit of effort to make this come to reality completely worth it. Really special night for them. And you realize that there are going to be many, many more events and evenings and days and enjoyable moments for families in this space. It's going to be a big part of the rainbow experience for many patients and families. I love this. It's so cool.